Go. Okay, stay. Okay, so when palpating the hip, we're looking for anchor point 10 minutes, swelling, deformity, crevice, and temperature change. So start with hip palpation. We're going to go ask them first, can I touch your hip? Yes. You're going to go ASIS, and inferior, you're going to go AIIS. On the side, iliac crest, have them pupils on the other side. On the lateral side, you're going to go ahead and palpate their greater trochanter. And then if you have them flip over, ask them again if you can palpate or touch their buttocks. And you're going to go PSIS, sacrum, coccyx, and then ischial tuberosity, hamstring protector. So on the posterior side for muscles, you have the hamstrings, which go from the ischial tuberosity down to the posterior condyles of the feet of the tibia. Glute max, glute med, you have them flip back over. You have sartorius going from ASIS to the adductor tubercle. And then you have your adductors on the medial side of the leg, your rectum going from AIIS to tibial tuberosity. And then on the lateral side of the hip, you have your tensor fascial latae, TFL, which attaches to the IT band. So for manual muscle, oh, and then you have one more hip flexor besides rectum, which would be your iliopsoas, which originates off T12 through L4 and inserts on the lesser trochanter and femur. So to start with special tests, we'll have them come to the edge of the table. And we're going to do rectum, so knee extension. You're going to place one hand above their knee to stabilize, and the other one on their ankle, move to the side so you don't get your face kicked. And for concentric, you're going to have them push out. That would be knee extension. And then for hip flexion, have one hand on their back, one hand just above the knee again, and have them pull their knees to their hips. And then we're going to do one more in the seated position, the sartorius. So you're going to have them try to bring their heel to their opposite knee as you go, and you're going to resist with your left hand at the knee and your right hand on the heel, and go ahead and go, and resist them up. Now if you have them lay on their stomach, we're going to start with hamstrings at the knee, so have them relax your leg, bend it. We're going to do isometric, so don't let me pull you out. And that's just all the hamstrings. If you internally rotate your tibia, it would be semimembranosus, semitendinosus. If you externally rotate, it would be biceps bend, same thing, don't let me pull you out. For hamstrings at the hip, you're now going to ask them to lay with their legs straight. You're going to place one hand on the lower back, the other one around their back area. You're going to ask them to raise their full leg to the sky. So go. That'd be isometric. Then if you bend their knee again to test glute max, you're going to put resistance on their heel, again on their lower back, and have them go to the sky. Now if you have them flip so you're facing the wall away from me. To test glutes med, you would have them on their side, and this is testing their right glute med. Yeah, that's her right. One hand on their hip, the other one on their lateral lower leg, and have them raise them foot to the sky. And then the other for adductors on your left, bend, push your leg up. Have them bring their left leg to the sky and say, don't let me push you down. Isometric, and then lay on your back knee. And the last one would be TFL. So the TFL, since it's on the lateral portion of the leg, you're actually going to have them hip flexion, and this is abduction. So you're coming up at an angle, and then how do you hold it here? Hold your leg there. And then don't let me push it down. So then, and then special test of manual muscle test. Again, you're looking to grade them on 5 to 0 scale, 0 to 5. 5 being they can go against your resistance, against gravity. 4 being they can go against minimal resistance but still against gravity. 3 being they can go with gravity. I'm so backwards. Yeah, 3 they can only go against gravity. 2 they can go with gravity. 1 there's contraction but no movement. 0 there's no contraction, no movement. So then manual muscle test of the hip. Special test. That's not manual. Special test of the hip. We're going to start with. We're going to do the anterior impingement test. So for this one, you're looking for a possible labrum tear is what you suspect. So you're looking to internally rotate their hip and just looking for pain or discomfort as well as possible clicking in the hip that they will feel deep inside. So what you're going to do is bring them up to 90 and 90 and just internally rotate their femur and ask them if they have pain like that. That is not for labrum, that's for impingement. Muscle impingement. This one's for labrum, hip scoring. So if I had a stool with me, you're same thing as the anterior impingement. You're applying an axial load on my body weight, and then you're going internal and external, asking for if they have pain, discomfort, or popping and clicking. The anterior impingement is just for pain or discomfort and internal rotation. Then next, have them face the wall again. This one's going to be over, so you're at the table. This one's going to be Ober's test, so you can hold on to the other side. This one, you're testing for IT band, TFL tightness. So you're going to go ahead and bring them into knee flexion and hip extension. Slowly let their leg extend and then looking for their leg to drop. If their leg were to hover around here, it would be positive. If it drops past the midline, it is negative. A positive test implies IT band tightness and TFL tightness as well. Then we're going to have them stand up. We're going to do that Trendelenburg. So for this one, why don't you face that way? So for this one, you're going to palpate their PSIS right in there, and then you're going, if you're testing for the left glute knee, you're going to have them raise their right knee to their chest. So in this one, you're looking for them to drop. You put your leg down. So if her right leg is up, you're looking for them to drop, the right hip to drop, which would indicate a weak glute knee. Implications of hip dropping, or sorry, positive test would be the hip dropping. You get back on the table. In the prone position, you are going to do, first we're going to do femoral nerve traction. So for this one, I'm going to flex her knee and extend her hip. And I'm going to ask if she has any burning, tingling, pins and needles, fuzzy feeling, the ants go marching down. And that would be positive for possible femoral nerve pathologies. Negative, they don't feel anything except for a nice stretch. The next one we're going to do Eval's. So you're just going to bring their heel to their butt. And for this one, you're looking for them to twist or rotate off, which would imply a tight iliopsoas. Positive, they twist, not positive, they don't twist, they're able to stay on the ground on the table. Oh, and the last one, have them sit on the edge of the table for the Thompson test. Thompson is for the Achilles, Thomas is for the head. So have them bring, we're going to test both, so bring your right knee to your chest and fall back on the table. So this one, on this side, you're looking at their left. If their quad femur is off the table, it would indicate a tight iliopsoas. If their leg is extended while they're relaxed, it indicates a tight rectum. So go ahead and do the other side. Follow that. She's pretty even. So then next we're going to do range of motion. So we're going to have her lay back on her back. We'll do hip flexion. So for this one, you're going to line up the stationary arm parallel with the table. The axis of rotation is going to be her greater trochanter. So go ahead and bring your knee up. Just grab it, don't pull it. Just so, because your greater trochanter moves, so just line it up. Make sure your stationary arm stays parallel. And then you're going to say, go ahead and pull your knee to your chest as far as you can go. Keeping it parallel with the, keeping it parallel with the lateral epicondyle, the femur. Read the measurement. That would be passive hip flexion. If you have them flip over, do hip extension. So for this one, you're going to find the greater trochanter again. Your stationary arm is going to be parallel with the table. I'm going to have her keep her leg straight and raise it up again, as high as you can go. Up until the point where she's right before she twists and her hips come off the table, or her right hip comes off the table. So find the greater trochanter, keep it parallel, go ahead as far as you can go. You don't have to read that measurement, and then that would be the active hip extension. So we're going to go to the edge of the table, and we're going to do internal rotation. So for internal rotation, opposite. So you're going to ask them to bring their foot out and internally rotate the femur. So to start, you're going to so your axis of rotation is going to be the middle of the patella. You're going to try and keep the stationary arm perpendicular with the ground. And then the moving limb is going to line up with the tibial tuberosity. So normally you can mark it or you can just palpate it as you go. So go ahead and have you internally rotate. And you're just going to make sure, make sure that your stationary arm is still perpendicular. Read that. She actually kind of has a lot. Be almost 30 degrees in internal rotation. No, that's wrong. That's not 30. That's 30. And then you're going to have her going with out. Then you're going to have her externally rotate. If they're that flexible, they can do that on the table. So same place, axis of the patella. Stationary arm perpendicular. This time have them bring their foot in. Line it up with the tibial tuberosity. Relax. Read the measurement. She is at about 59. No, that's wrong. No, that's fully right. Then we're going to do adduction and abduction. So go ahead and scoot back. We're going to go both ASIS, the axis on the leg that you were testing, and the stationary arm lined up with their opposite ASIS. So sometimes you can ask them to hold their opposite down. And then you're going to line up the stationary arm with their tibial tuberosity patella area. And then this one, so we're going to do abduction first. You're going to have them bring their foot out as far as they can without externally rotating. Just go ahead and go. Keep it lined up. There you go. Good. and then that would be her abduction. And then have them move this foot off to the side, keeping their hips parallel. That way it's off the table, so it's in place. Now we're going to do abduction. ASIS, opposite ASIS, a little bit down. And then line up the moving arm and have them bring the foot all the way across their body. And that would be your abduction. Then you're going to do leg length discrepancy with this handy guy. So this one, you're going to go both legs, you're measuring in centimeters. You're going to go from the ASIS to the medial malleolus. You could either do the top, middle, or bottom of your medial malleolus as long as you keep it consistent every time you're measuring, and obviously on both legs. So you're going to line up the 0 of the centimeters for ASIS, have them hold it, hold on tight. Make sure they pull it tight. They hold it tight, you pull it tight, and then I'm going to measure just to the top of it. She is at 84 centimeters. Then we're going to go opposite. Palpate, line up the 0, have them hold it. Yeah. And then you're going to, I'm going again to the top of the medial malleolus, and she is just over 84 centimeters, so she's about a quarter of a centimeter off, which means she's able and functional to walk. Looking at leg length discrepancy, you're looking for anything more than 1 centimeter would be a concern for possible biomechanical changes in gait or muscle imbalance and whatnot. Yeah. Ta-da.